Are you a pharmacy student who wants to learn more about postgraduate training opportunities such as residency or fellowship? In this video, I'll teach you about the roadmap to residency and the application timeline. Stay to the end for advice for first, second, and third year students. Hi, I'm Dr. Jessica Louie, and I'm an associate professor, board-certified critical care pharmacist, and entrepreneur. I help people find meaning beyond a job title and burnout. On this channel, we talk about passive income and simplifying to combat burnout and stress in your life. I also talk openly about my burnout journey and our debt-free journey from massive student loan debt during residency. Make sure to watch those video links below. This video is not sponsored and is my personal opinion. Now, if you don't know about my own residency journey, I completed a PGY1 in pharmacy practice in 2014 and a PGY2 in critical care in 2015, both from accredited ASHP programs. Now, on your roadmap to residency, this is a really exciting time. It can also be a time where you are preparing weeks to months in advance for your residency applications and fellowship applications, and it's great to have some prep work in advance. So we're going to go over what I think you should be doing each month in this preparation phase. Now, later on in this video, I'll talk about steps for first, second, and third year students. And right now, we're going to be focusing on our fourth year pharmacy students. Now, the earlier start, of course, the better, so that you're not overwhelmed at the deadline process. Now, in July of that process, we want to be updating our curriculum vitae, our CV. And if you've never updated this before, we have templates and workshops linked below. And start thinking about who do you want to ask for your letters of recommendation. These are important in your written application process. So start making a list of preceptors, faculty members, supervisors that you think would be great recommenders for your application. Now, in August, we're going to be starting to think about what type of programs are you interested in applying to. And maybe you've already started this process earlier, but being able to get specific and list out all the programs you're interested in looking into more details on, I highly recommend keeping this on an Excel file so that you can track each of the programs, you can compare the programs to one another, and you can write down the information about them, write down the websites about them, so it's all linked in one document for a great comparison. Now, if you would like to get our free Excel file on how to compare residency programs, you can get that free download linked below. This is also the time where you're going to start investigating if a program has an open house so that you can attend their open house if it's local to you and you can go into that institution, or if they have a virtual one as well. Most open houses occur during the fall season, so being able to prepare in advance and get those on your calendar can be really important, especially if you need to schedule rotations or ask for some time to leave early one day and stay late another day. Now, moving into September is part of your conference registration season. So a lot of our conferences, including ASHP, CSHP, ACCP, will have conferences in fall. And those deadlines to start registering are starting to occur. So you want to decide what conferences will best serve you, what conferences will have the best return of investment, both for your time and financial situation, so that you can attend the conferences that are going to have programs you're interested in talking to and getting more information about these programs so that you can make an informed decision if you're going to pursue the application process. So please start registering for those. Make sure you get the early bird registration if possible so that you can save a little bit of money and attend the conferences that fit your needs. I personally recommend attending ASHP mid-year conference. It's the national one, and I think that has the most programs at it, but please make sure that you make an informed decision if a state conference would be a better fit or one of the other conferences. Now, in September, you're going to start asking for your letters of recommendation, whether that's from preceptors you just had this past summer, or from faculty members, or from supervisors. No, you don't need to give them all the information about how to write the letter yet, but you want to ask early to make sure that they have the time set aside to write you a strong recommendation. Now, it's really important that you ask for a strong recommendation, and the person you're asking will tell you the truth. If it's a yes or no, they can write you a strong recommendation. This also will make sure that they have the deadlines ahead of time so that you know that they have the next 2 to 3 months to write you a strong recommendation. Maybe some people will say no, or they have other commitments at this time. So knowing that early on will help you so that you can see if a different person would be a good person to write your letter of recommendation. Now you're continuing to narrow down the residency sites that you're interested in and fine-tuning your Excel file. Please make sure that you're not getting overwhelmed during this process. Yes, you might be interested in a lot of different programs. I personally had 30 to 50 programs on my list, and I narrowed it down as the months went on during the fall. So you can list a lot of different programs, and then you can start narrowing down that list as you go to conferences and go to open houses. Now in October, you're probably going to be attending some of the open houses, talking to different programs, possibly attending some of the conferences, depending on what month they fall in, and getting to know the programs, getting more information on them so that you can make an informed decision about who you're going to apply to. Now in November, you're probably going to start asking for transcripts from your school to be sent to the appropriate portals and application processes to make sure that they are sent in on time. You're also going to be checking in with your letter of recommendation writers to see if they're on time and are still committed to getting your letter done in December. And then also making sure that you're continuing to attend the conferences or open houses that are happening. You may also be finalizing some travel plans so that you are attending those conferences and making sure that they align with your fourth year rotations, making sure that you're requesting the necessary time off or making up that time on different days. Now in December, you may be attending ASHP mid-year conference and the PPS, the personal placement service as well. And this is definitely optional. I know that some PGY 1 and some PGY 2 programs attend PPS. I personally use PPS for my PGY 2 program, but not for my PGY 1 program. But you can see what programs are there and make an informed decision about signing up for that personal placement service. Now you're probably attending the conference and then you're continuing to take notes on your Excel file, compare the programs to one another, and start narrowing down where you're actually going to fully apply to, because applications are going to be due at the end of December or early January for most programs. Now, after the conference in December, you're going to continue to narrow down your list. So maybe if you had 30 to 50 programs on that list, you're probably narrowing down to about 15 to 20 programs. And I think 10 to 20 programs to apply to is a great number. 15 to 20 is even better, so that you have your top choices and then you have some backup choices as well. January is a fun season. You might be submitting last minute applications that are due at the early part of January and then waiting for interview invitations. So likely most programs will invite you in January and give you dates to interview either at late January, sometime in February, or early March. That's typically the interview season. So then you can start preparing for that interview and thinking about what types of questions they might be asking you, what type of questions do you want to ask the program, and I have a completely separate video on how to prep for that interview and questions to think about, so you can watch that video as well. We're also going to start preparing in terms of clinical questions for the interview and behavioral questions for the interview, reviewing your CV during that process. February is interview season, it's continuing, and you might be traveling for some of those interviews. And it's really important that you take notes during those interviews, either right after in a written format or leaving yourself an audio message right after the interview, so you remember how you felt after that interview, so that you can start thinking about your rank list and how you're going to rank the program. Now in March, your rank list is due. So if you did interview with a certain number of programs, you're going to decide if all those programs are going to be ranked or if only some of those programs are going to be ranked, and decide to submit your rank list for phase 1 of the match. Now, phase 2 of the match will also occur later on in March or early April. And match day will also occur in March. So you're getting that list ready, making sure that you are submitting it before the deadline, making a really intentional decision of how you're going to rank the programs. And I have a completely separate video on how to rank the programs, so you can watch that video as well. Now in April, you either have gone through the first phase of match or the second phase of match. And if you matched at a program, you're probably signing the contracts for that program and now applying for licensure and thinking about how you're going to finish up studying for that licensure or possibly graduation this month or next month from pharmacy school. Now in May, you are probably finalizing graduation, finalizing licensure prep, and in June, you're going to be taking your board exams, either the NAPLAX, the CPJE, the MPJE, and if you would like advice on how to take and study for the NAPLAX or your state board exams, I have separate videos on that as well. Now, the majority of residencies start the last week of June or first week of July, so you might be relocating to that location and getting prepared for that transition phase. Now, finally, you're going to be starting to enjoy your residency for the next year or two and meeting the team and learning lots. It is a transition that I do recommend you prepare for. Don't overload your plate during that transition and really enjoy all the opportunities that present themselves. Now, what about first, second, and third year pharmacy students? I do recommend that you get involved and look at different opportunities as they present themselves, whether that's through pharmacist intern positions at different organizations, volunteer and co-curricular activities, leadership positions, research opportunities. There's lots of different things depending on your interests that you can be involved in. And being involved and getting to know the different organizations early on can be really helpful, so then you can start narrowing down what you're really interested in and narrowing down your focus as you go through your second and third year of pharmacy school. Now, if you're also able to attend conferences either on the local, state, or national level, as a first, second, or third year pharmacy student, I highly recommend that. I attended a lot of conferences during those years in pharmacy school, and it's a great experience to get to know the conference environment, know how to interact, and know how, these large conferences are held each year. You can also get involved with submitting posters or abstracts for these conferences to learn how to present your research at these conferences early on, besides presenting as a fourth year pharmacy student. Now, what about fellowship opportunities? Yes, fellowship opportunities may have the same timeline as residency opportunities. They may go through the same ASHP match program as well, but some may not. So the timeline might apply to most fellowships, but some of them might be a little bit different, where they're not going through ASHP accreditation and have a slightly different application season and review process. So please be sure to check those specific websites and their application deadlines so that you don't miss any of those. Now, if you're interested in more templates and information on curriculum vitae and letter of intent, please be sure to check out our workshops and resources linked below, and make sure that you're watching the rest of our residency series coming up so you know how to prep and find the correct residency program, prepare for the interviews, and prepare your rank list. Until next time, cultivate joy.